Cannabis remains the most commonly used substance, but the report highlights a troubling surge in synthetic drugs and opioids. It also draws critical links between drug use and broader social challenges, including mental health disorders, rising crime rates, and entrenched poverty.
Key findings. As for drug seizures, in 2024, we have to, like I said, we have 12 reporting countries. So we have over 953,000 kilograms of illicit drug that have been seized, and about 1,500,000 kilograms of diverted pharmaceutical tablets. And this includes hundreds of thousands intercepted in transit. Specifically, cannabis is about 90% of all drug quantities that have been seized in the region for 2024 reports, and is beyond 418 tons. So this is showing us that the weed spirit is great, and also we have a domestic demand. For cocaine, we have 13.2 tons that have been intercepted during across these 13 countries. So the key transit corridor, in fact, is the major explanation of this diversification of smuggling routes around along the Gulf of Guinea. For heroin, we have 260 kgs that have been seized. For ATS, we have 23 tons plus over 450,000 tablets. For some opioids, we have 6 tons and over 5 million tablets. Other cannabinoids like kush, hashish, squinch, resin, or crack. So it has reached 248 kilograms. For VAPs, we have
The report is a vital resource for policymakers and public health officials, offering data-driven insights to guide prevention and treatment strategies. Speaking at the launch, Dr. Sintiki Trafa Uba, Director of Humanitarian and Social Affairs at the ECOWAS Commission, underscored the importance of WENDU as a regional platform. She noted its role in helping member states identify vulnerable population and tailor intervention accordingly.
WENDU reports reportedly identify that there is a regional treatment gap. To address this challenge, the ECOWAS Commission has invested heavily in capacity building, training more than 200 professionals across 10 member states. If you read the report, you will see what cannabis is doing, amphetamine-type stimulants, local drugs that are being produced, and of course, ravaging on our youthful population. So this is an important aspect of the work we do at the Commission. We've done universal treatment curriculum training, universal prevention training for member states. The Commission has financed the renovation and equipping of 10 treatment and rehabilitation centers in our member states, representing an investment of 1 million. So you can spend 600,000, 500,000, 200,000 to host a meeting. But what we've decided to do is to take 1 million and put it into drug treatment rehabilitation.
The ECOWAS Commission reaffirmed its commitment to supporting WENDU through technical assistance, resource mobilization, and enhanced collaboration among member states. The establishment of WENDU comes at a pivotal moment, with drug use trends worsening across West Africa. The network is poised to drive coordinated, evidence-based response. Mr. Dembasisi, Director General of DLEAG, reiterated the Gambia's full support for the initiative. He described WENDU as an essential tool for understanding the evolving drug landscape and implementing effective interventions.
The availability of reliable and evidence-based data on the national and regional situation is among the key objectives of WENDU. Consequently, the findings of the WENDU report are crucial in giving a comprehensive analysis of the drug situation in our country and in the sub-region, including but not limited to the quantities of drugs that we seize annually, the dynamics of the drug situation among our population, particularly youths, the advent of new psychoactive substances that are very attractive to young children and young people in this country, as well as treatment services offered to substance abuse disorders, among other issues. Therefore, ladies and gentlemen, the launching of the WENDU report here in the Gambia is a strong testament of our shared values and commitment for a much safer, secured, and healthier communities for our country and for our sub-region.
Mr. Sisi pledged active participation in data collection and analysis, emphasizing regional cooperation as key to protecting citizens from harmful effects of drug abuse.
The WENDU report is far more than just a document for us. It is a compass that will guide national and regional drug law enforcement agencies and health agencies to design policies and practices fit to support people with substance abuse. Equally, it shall also provide us the requisite data that will bring about a shift from reaction to proactive interventions. Ladies and gentlemen, as we launch this report, let us start to make it our shared blueprint for the application of evidence-based knowledge and for prevention, treatment, and rehabilitation of young people with a range of aftercare services. Let us also endeavor to share the findings of this report that we are about to launch this morning.
Representing the Minister of Interior, Deputy Permanent Secretary Abraham K. Mendy echoed the government's commitment to tackling drug abuse both nationally and regionally. He praised WENDU as a collaborative platform for data sharing and the implementation of evidence-based strategies.
It is understood that the launching of the WENDU report coincides with the review and assessment of ECOWAS Commission's intervention and support to the member states, which I am glad that Director General and the Director of Humanitarian Affairs have mentioned the support they have given to the Gambia. The center is the first ever drug treatment facility in the Gambia. Therefore, the government of the Gambia wishes to take this opportunity to extend sincere appreciation to the ECOWAS Commission for support and equally support the request of DLEAG for the complementary facility. We also wish to express appreciation to the Commissioner of Human Development and the Social Affairs Division and her team for the support and guidance during the process. We hope and pray that the assessment to be conducted will give due consideration to the request for complementary facility that will help provide comprehensive treatment and rehabilitation services.
Launching the WENDU report and completing policy brief, Dr. Maimuna Jarjue, Director of Health Services, called attention to the neglected state of mental health in the region.
Among the 8 priorities intervention identified in the investment case is clinical care for alcohol use disorder, a condition that is deeply intertwined with the drug use pattern documented in the WENDU report. This convergence of evidence demands a new approach, one that is integrated, compassionate, and rooted in public health. Today, we celebrate the completion of the Gambia's first specialized drug treatment and rehabilitation center. This is not just a building, it is a promise that those living with substance use disorder will no longer be treated as criminal, but as individuals in need of care.
The 2024 WENDU report paints a stark picture of the drug crisis in West Africa. Addressing this rising trend, particularly among young people, requires a multi-sectoral approach involving prevention, treatment, and law enforcement. Regional cooperation, community engagement, and sustained investment are essential to safeguarding public health and building a resilient future. For Star TV News, I am Maimuna Jarjue.